Hello, friends. Once again, there's news from China about the spread of the virus. Over the last few days, many videos have gone viral showing crowded Chinese hospitals with patients exhibiting flu-like symptoms. The biggest fear among people now is whether this will turn into a sequel to COVID-19. Remember the novel coronavirus that spread globally 5 years ago? This new virus, called HMPV or human metapneumovirus, is causing concern. But how dangerous is it? What even is this virus? Let's dive in. First, it's important to know that HMPV isn't new. Discovered in 2001, this virus has been around for a while, unlike COVID-19, which originated in 2019 and spread from bats to humans. HMPV is believed to have originated in birds 200–400 years ago. It was first identified in humans in the Netherlands in 2001. So why the sudden panic? This virus has been active every season, often mistaken for the common cold. Symptoms include fever, coughing, a blocked nose, and difficulty breathing. The incubation period is about 3–6 days. Most people recover on their own, but children and the elderly can suffer more serious complications like pneumonia. According to Professor Paul Hunter from the University of East Anglia, almost every child under the age of 5 has had an HMPV infection at least once. This virus spreads like the common cold and flu, through droplets from coughs and sneezes or by touching contaminated surfaces. To protect yourself, maintain proper distance from infected individuals, cover your nose and mouth while coughing or sneezing, and wash your hands regularly. These precautions are useful even for the common cold. Most healthy people don't need special treatment. Stay hydrated, rest at home, and you'll likely recover in 5–10 days. However, those with compromised immune systems may need hospital care. Now, let's talk about the severity of this virus. There are no vaccines for HMPV due to safety and efficacy issues, but don't worry. Many scientists believe that mild infections help keep our immune system active. So, what's happening in China? The National Disease Control and Prevention Administration has acknowledged a rise in respiratory infections, including HMPV. However, the Chinese Foreign Ministry says the scale is lower than last year. Experts suggest this is a typical bad flu season. India and Bangladesh media have exaggerated the situation, causing unnecessary panic. Reports of HMPV cases in Bangalore, Gujarat, and Tamil Nadu have surfaced, but none of these cases involved international travel. WHO's former chief scientist Soumya Swaminathan confirms that HMPV has been in for years. The real question is, why is this news gaining traction now? China's strict zero-COVID policy meant residents weren't exposed to viruses for years, leading to an immunological deficit. This winter, China is seeing a surge in respiratory illnesses, but it's not as severe as last year. The World Health Organization is monitoring the situation closely. Experts say HMPV is not as dangerous as COVID-19. Most people have some immunity against it. Dr. Anesh from Kerala One Health Center and Dr. Gagandeep Kang confirm that reinfections are usually mild. According to a study in The Lancet, HMPV caused 16,100 deaths in 2018, mostly in children under 6 months. The mortality rate is much lower than COVID-19, closer to that of influenza and pneumonia. So, friends, the panic on social media is largely exaggerated. Follow the hygiene precautions I mentioned, and don't worry, there are more serious issues that need our attention.